Hi, parents. Welcome again to another episode of Thrive with Your Family. This is a weekly web series hosted by Michigan Medicine, put together by C.S. Mott Children's Hospital and the Department of Psychiatry. We're happy to have you back for another week where we can talk about how we're coping with the COVID-related school closures, stay-at-home orders, and all the other stressors. This is our fourth episode, and we're going to be talking about children with special needs, such as autism, ADHD, developmental delays, or who've been receiving special services in school and now maybe struggling a little bit more with stay-at-home orders and school closures. So we have our great panel back again this week. We have Melissa Cousineau from Child Psychology, Sheila Marcus from Child Psychiatry and the MC3 program, and Kate Rosenblum from Child Psychiatry and the Zero to Thrive program. Last week, we talked about teens and how they're coping at home during COVID. And we really appreciate all the comments and questions that parents have been sending in and hope that these times have been helpful. Today, we're going to cover a few topics related to kids with special needs. The first is helping children with developmental delays who might need some extra support while they're home with you. Second, helping kids with autism both cope with these sudden changes in their lives as well as maintaining relationships when schools are closed. And finally, some ideas for how to encourage sibling relationships and not conflict so that you can stay sane, but also so that kids can learn social skills at home from each other. And I'm going to touch a little bit also on how to make the most out of video chat, since your kids might be doing a lot more of that lately, and which may be hard for some of the little ones. Okay, so welcome everyone. Thanks for coming back. And we're going to start with a question that we got from a parent who said, how can you homeschool a toddler who just turned 4 in January, who's resistant to homeschooling and also has a speech delay and needs to work to make progress? How much do you push it? We currently try to read and do short crafts, but 30 minutes or less total. We also include him in everyday activities and play with a lot of questions and answers and words and reading at night. But he's really a bit feral. I love that word. Thank you for using that. As the youngest of 3 and isn't sitting well for anything but a preferred task. Yes, I've totally been there. Even when you suggest a preferred task with you, if it's not his idea, he wants none of it. All right, so Kate, what do you think about this I've heard this from a lot of parents with kids who have developmental delays and who, now that they're home, they're like, I'm home, I'm in my special comfort zone. I'm just gonna do all the things that I love to do. And those non-preferred tasks are like pulling teeth sometimes. I'm hearing this from lots of families. So let us know what you're thinking about a case like this. And you need to unmute yourself.
Thank you. This is modern day life, remembering to mute yourself. So thank you for that. Well, I just have to say my first thought is not only thanks for the question, but also just noticing how many things this parent is already doing and really thinking about and how terrific that is. So, it is understandably incredibly hard and challenging to be sort of navigating homeschooling, not just with a child who's typically developing, but with a child who has special needs. Most of us are not teachers, and we're especially not special ed teachers or speech language pathologists. And so really navigating how to meet kids' needs right now at home can be especially challenging. A number of the things that this parent is doing, however, really tell me that they know their child and they're working really hard to figure out how can we make this successful? How can I sort of build it into routines? And those are some of the things that we'd hope might be helpful. But before we sort of delve into what some of the strategies are, I think really recognizing also that this isn't unique to kids with special needs. Like parents across the board are coming and talking, I think, with all of us here about how hard it is to navigate balancing the homeschooling sort of expectations, work at home, and sort of meeting kids' needs. And, your child is not falling behind. All kids are sort of on pause in some ways around some of these learning experiences. And we know from quite a lot of experience that, even if kids regress or sort of don't have that support, when those things pick up again, they're really going to rebound. They're going to acquire. So I think we can also sort of let ourselves calm ourselves a little bit, and give ourselves a break, because this is really hard. It's extra challenging when you have a child with special needs, and everyone's in this boat. But that said,
and I just want to add there quickly, is that a lot of the families that I know or that I take care of have been probably setting up the child's educational supports. I have some patients who just had the IEP meeting, finally, right before schools closed. They had been advocating to get the right teacher, the best, match of peers in the classroom, the right sort of supports, and they might have finally been seeing some growth this year. And so that's a source of grief that I think is understandable for parents, and that is absolutely okay. Unfortunately, we don't have much we can do about it, but just to recognize your grief reaction and say, I worked so hard to get to this point, and here I am trying to pretend that I can be all these components of the IEP. So really normal reaction.
Completely agree, Jenny. And I think, and it makes sense to feel that way because, most parents that I know are working so hard to advocate and to move things forward and not to let things stall. And so this just feels really, really hard. So I think thinking a little bit about what you can do, because this isn't lost time. It is a little bit of a pause. I think we have to set realistic expectations for what we can do. And also what he can do, this little guy, or, for other parents, what their children can do. One thing that I also just want to add to sort of normalize and contextualize a little bit is that all kids are experiencing some loss of control right now. They don't get to go to school. They don't get their same routines. They're not around their teacher, their preferred peers. All of those things have shifted. Routines have shifted. And loss of control for little kids can show up in lots of ways. It can look like acting badly or sort of acting out. And then you add to it something that we know is especially challenging for kids who have language delays, and that is that it's harder for them to use words and language and communication to sort of express feelings, to work out sort of what it means for them to have all those changes. And you might see even more acting out, or maybe more sort of asserting control, like, I feel out of control in all these other ways. And, this is one thing that I can say, no, I don't want to do. And I don't necessarily have the words to navigate it. So I want to sort of put that in perspective, that some of his sort of acting out and oppositional behavior at times might also reflect some feelings that he's having about the situation. And so in that sense, some of the things we've talked about in previous episodes about talking with kids about their feelings, giving words for feelings are very important also at this time. And we might put ourselves in the role of detective, looking for what's the feeling behind the behavior. Like, it's hard to have to do this at home, or you might miss your teacher, you miss your friends, or, to sort of allow for those hard feelings. But then I think sort of thinking about strategies, a couple of things that this parent already acknowledged that I just want to underscore for all other parents, because it's great. Sort of thinking about shorter bursts. If 30 minutes is all he can do, hey, 30 minutes, that's great. Actually, if you think about a lot of sessions written into IEPs, even the sort of accommodations or services are often broken into 15 to 20-minute blocks of time, because it's effortful and it's hard to sustain kids' attention. So giving yourself a little bit of a break and think maybe 30-minute blocks is great, and that's what we can do. If it's a loss of control that is part of what he's experiencing, or it's sort of hard for him to take in other people sort of making the plan, I wonder about sort of finding a moment where there's sort of calm, some downtime in the family, and maybe all the kids could work together to map out their plan for the school day and set a schedule, essentially, that allows him in a moment of calm, when he doesn't have to do it, but actually can think about what would work, for the next day to come up with some activities and maybe even make a picture schedule where he can draw in pictures to go along with the activities at certain points of time. And if all the kids do it, it kind of normalizes it too. So it gives him some control.
Gives him that sense of control. And I think that is it's crucial. I've been hearing families frustrated when their child just wants to control clothing. I don't want to get dressed in the morning. I want the same exact pair of leggings that I've worn the past 3 days. Like that is one way that this crops up, and you feel like, why am I starting the day with this huge battle over what you're wearing? So letting go of some things, or accommodating, right? That's one thing school does, is they make accommodations. You don't have to have the same exact expectations for every child, and you can have one child who wears the same leggings every day. If that's a battle, it's one of those, rubber balls. You're willing to let it drop.
We say sometimes, don't let the perfect be the enemy of the helpful. So, figure out what are the pieces that you can be successful at or that he can be successful at, and then let go of other things, because, it's not going to be possible to sort of do it all. Not for him and not for you. So letting that be okay.
Yeah. Do any of you, Melissa or Sheila, have suggestions for ways to try to reduce defiance? And when I say reduce defiance, I mean that the way we either make a suggestion or give an instruction or even set a child up for a non-preferred activity can really increase or decrease the likelihood that they will refuse. So one thing I talk about with patients is use of like demand language, directives. So if you say, go over there, get your shoes, put on your shoes, come on right now. All of those carry this level of pressure that some sensitive children really push back upon, especially if a child's feeling out of control and they try to dig in their heels. So I'll recommend using open-ended language, like your shoes are over here, or everyone's coming together for lunch right now. So I'm curious, do the rest of you have a few tips of ways to word language or ways to, there's my earpiece, ways to get almost Jedi mind trick kids into being the May the 4th that we're recording this. I think talking about Jedis is appropriate. What sort of tips do you have?
So one tip that we often use, Jenny, especially with kids who have trouble with transitions, is the 5-minute warning, which is we have about 3 minutes left on this activity, and then we're going to be doing that. We also often use first this, then that, often putting the that being kind of a fun thing. So first, we're going to work together on math for about 15 minutes, and then we're going to take a break and go outside and walk. And often that's something that will help get kids able to, especially if they have a little competitive streak or really want the thing, they'll sort of move toward it. So those are two techniques that I've used.
And I think something that we see that many teachers use in schools that we could also use in our own homes is, there's often these little reward or sticker charts on children's desks, and when they're staying on task, that teacher will walk by and give them a little star or give them some little signal that is, catching them being good, rewarding that behavior that we want to continue to promote and continue to see. So, when your 4-year-old is working on that task, even though they don't want to, and you as a parent are walking by and you see them working on it, really making sure that we're acknowledging that we're paying attention to that we're catching them doing that. And, it may be some system that you have in place that once they get those 5 smiley faces or those tallies, then they're getting that 20th snack for the day from the pantry. The other battle we're dealing with is lots of snacks at homes, right? But I think that's a good thing that taking some of the things from the classroom that is helping them and putting them into place at home as we're able.
And I would just say for all the kids we're talking about today, checking in with a teacher who knows the sorts of fun activities that the child refuses the least might be a way to pick your battles, that you choose a few non-preferred or educational activities, and then you let go of the others. You don't need to complete the whole list on Seesaw or Google Classroom or whatever it is. and the other time focus on the social and emotional wellness of your family adapting, or playing a game where the child needs to be flexible, or they need to work together with you, and you kind of build the bond that helps them say yes to you the next time you ask them to do something.
And just to build on that, Jenny, and sort of thinking about this family that wrote about their experience, the opportunities for working on language are so many. So it's not just social emotional, but opportunities for communication and language while playing board games and talking about daily routines and talking about preferred activities, and sort of thinking maybe by email with, or in a conversation with your child's special ed or language therapist, speech and language therapist, to think about what are some of the things that we could work on, and what are some of the nice ways we could embed that in our routine. And I know that also the American Speech, Language, and Hearing Association has some really nice ideas for parents, sort of tips for how you can build that into your routine. And I think some of those will be available on our website on Facebook as well, for parents to look through and think, oh, that's a way I could actually accomplish this without sort of maybe encountering the resistance, but just sort of naturally building it into our family routine and activity.
Yeah, that's great. And then it feels like fewer tasks for the parent to do also. I think one thing that's overwhelming is we all feel like, oh my gosh, I'm not doing enough for my kids. And so knowing that a lot of this learning is going to happen informally, just through our daily interactions and play, or even when you're outside laughing and telling stories. And just one little media tip is that if you need a break and your child is watching TV or something, the shows that actually have an evidence base to help kids learn new words are things on PBS Kids generally. So like Martha Speaks or Word Girl or some of these other shows would be preferable to something else that's really not, tested or informed by developmental knowledge, like what you'll find on YouTube. So I would just encourage, again, it's another way of you feeling good and less guilty about the fact that kids are using screens more, but you can find kind of nutritious forms of content that would actually help with some of those, the things we want our kids to work on. So, and if they want to work on frustration and emotions and doing things they don't want to do, then Daniel Tiger is also a good suggestion there. That has evidence to help that it helps kids with their social and emotional development. Okay, great. We're going to switch gears now to questions from a couple parents about autism. One parent wrote that they really would like to hear more about resources help for a nonverbal, high-functioning autism. This parent has 3 boys that she's now homeschooling. The youngest, a first grader, is autistic. Others are 5th and 7th grade, but not having these resources available for development sounds like it's an issue. And those were speech, occupational therapy when school ended. So this parent was questioning what sort of resources are available online to help kids continue their development and not have them fall behind now that schools are closed. So a similar question was from a parent who said, we're trying to start a community peer-to-peer online social skills group. And this is hard because when schools are closed, often kids then don't get the lunch bunch or the social skills group that they need. And this is also, the parent says, it's hard to find ways for kids with autism to connect with their general education peers that they've been connected with for some time, which become vital relationships that take such time and work to develop. So they're asking for strategies for families to find ways to fill the gaps. Now that special ed services are not as available, how can the community, either parents to parents or parents and their the child's therapists, can fill this gap and maintain these relationships? So those are 2 really great questions, especially what I've been hearing from my patients who have been receiving special ed for autism, but whose social skills groups where they get to sit and play a game and practice, social thinking. What is my peer thinking about? What should I say next to build upon what they just did? That takes a lot of work for a lot of kids. It takes a good facilitator who knows how to, bring it out of both children. And so I hear a lot of parents frustrated that they can't get access to that right now, at least in person. And video chat, as I'll mention in a few minutes, is hard for some kids to access. It's a little different when you're just looking at someone else's face on a screen. So Sheila, what sort of suggestions do you have? Both of these families are saying our resources that we worked hard for are not here right now. It's speech, it's OT, it's social skills. What are the general approaches you'd recommend when families are missing out on their autism therapies from school?
Sure. Well, it is a great question. And I'll start with some general information and then some more specific tips. And then I can talk a little bit about some of the links or places where I found some good resources. So to begin, don't forget that even though you may not be an occupational therapist or a speech and language therapist or a physical therapist, you are the expert, frankly, on your child. So don't discount the fact that you're better able than many, many people, most, to see the world through your child's eyes. That counts for a lot. And sometimes we talk about this notion, it's a mindfulness notion, really, about radical acceptance, which is, on the one hand, you've worked so hard for all of these strategies. You don't want your child to fall behind. You've just put together the perfect IEP, and yet, so you've done all of these things, and yet you have skills and you are the expert. So even though it may not be perfect, as Kate said, don't let the perfect be the enemy of the good enough. It will be good enough, and to sort of rest easy with that notion in some ways, and to stop struggling against the what if it's not perfect kind of thing. The other thing that I think is really important for all children, including parents of autistic children, are the notion that behavioral management strategies we often talk about as an A, a B, and a C. The A is the antecedent, the B is the behavior, the C is the consequence. And often we concentrate really hard on the behavior and the consequence, whether it is a reinforcer or a punishment or something to sort of turn down the behavior. But for parents of autistic children, we really rely a lot on the antecedent. What happened before the behavior? That's part of seeing the world through your child's eyes. So might this child be tired? Might this child be hungry? Were the transitions a little too rapid? Was the length of time in this task too long? Or was it a transition that was too abrupt? Sometimes it may be a sensory thing. So thinking about what's going on in this particular world right now. Are the lights too bright? Is it too loud? So that you can think about how some of those antecedents might have driven the behavior.
And I think that helps parents also understand if your child is stimming more right now, if your child seems to be a little bit more in their own head, if they seem to be overreacting to the smallest little frustration, we know the antecedent is this big change in their life right now. They're so used to the structure and the social input of their classrooms and the day-to-day flow. This is a big change for them. The grown-ups around them probably seem stressed too, and life is very different. So I have been reassuring families just to accept there's going to be a bit more of the behaviors that you might not have seen for a while, and to not worry that it's some failure on your part, or to worry that, it's never going to get back to where it was again. But understand the antecedents and help the child with those stresses, or the self-regulation techniques or communication strategies that might help them to address the antecedents.
Absolutely, absolutely. And knowing how to engage your child around some of these huge changes in their environment. So they can't go to school, but can they create a pictorial sort of, a flow of the day of, we're not getting on a school bus to go to school, but we're getting on our little school bus that we're going to draw, and we're going to go downstairs to our workspace. What are we going to call our workspace? What do we want to call our school? To think about what is it that really motivates your child? What are his or her interests? So that one family that I spoke to this morning said, when we, instead of a sticker chart, we call it leveling up, because that's what our child loves. And so he gets to level up to a new level when he completes a given task. We've already talked a little bit about movement breaks, which are really, really important. And then things like first and then to sort of help with some of the transitions. In terms of some of the websites, so the Michigan Child Collaborative Care Program has spent a lot of time kind of curating many of the resources that poured in the week following the onset of this. And there are many, many sites within the Michigan Child Collaborative Care COVID-19 website, educational resources, learning materials, college students and other students who have offered to sort of offer free tutoring to kids. That's a site called gopeer.org. Autism Speaks is a wonderful website. I'm sure most parents would be familiar with that website. They now have a thing called ASD Strategies in Action that gives families and service providers some of the tools to ensure that you're equipped. And it's about a 30-hour, so it's a huge program, but you may want to pick and choose from among several of those. And there are several other, again, within the Michigan Child Collaborative Care site, where they create social stories and COVID-19 stories to help children with autism cope. So I would encourage some of those.
And I think it's worth doing, even if your child has had the diagnosis for years, or you just, this is all new to you. Those resources can either be your introduction to some of the understanding of child behavior, teaching social communication and social reciprocity through play, so we'll be sure to post those on our Thrive With Your Family website. But also, if your child is years out, but maybe you'd need a little refresher to remember, how do I manage this negative behavior, or kind of give some way to shape the behavior and reinforce a replacement behavior. All of that is worth looking into. And I just wanted to address the question about maintaining the peer relationship. So I would really encourage families to you could ask your child, like, who was your buddy? Who did you like talking to or have lunch with? And try to set up just a FaceTime or Google Meet or some sort of hangout between those children. Sometimes it's hard when your child has a short attention span, or they get distracted by all the bells and whistles on technology. Having some structure can help. So asking the parent of the other child to get out a game such as Battleship that you can play virtually. You can play I Spy, where you're kind of looking at different things in the other person's, screen area. And that's like a perspective taking task. You can play word games. You can solve crosswords if both parents, print out the same thing. So it takes a little bit of creativity. But there is a lot you can do to just set kids up for success, to play together, to play Pictionary or do drawings, or even just to kind of show each other their funny toys and act something out. It's worth it to try to do that on about a weekly basis. Now, when it comes
my 3-year-old daughter and nephew had a FaceTime game of Simon Says last night. And so, they don't sit down and talk to each other, but they'll move with each other. And they were having so much fun doing that. So, some of those movement games could also be fun ones to incorporate.
Yeah,
it is. Dance.
I like doing.
Yeah.
I like doing that with Cosmic Yoga, and I like doing that with the Noodles Kids Dance as well. Mm-hmm. They can have a lot of fun doing that.
Yeah, so the last thing we wanted to talk about is siblings. So another thing we're thinking about, if you have a child with autism or some other developmental behavioral issue that makes it harder for them to sometimes get along with their sibling, or even if they're typically developing and sibling interactions have been a problem since everyone's cooped up at home, it would be great to think about how we can support sibling relationships simply as a way to teach social skills, right? It's a way to teach social problem solving, or to help someone take someone else's perspective. And we had a question from the last episode that unfortunately Melissa couldn't come to because her infant got sick. And that's life right now. So we all were flexible about it. I'm glad he's feeling better. But The question was, what tips do we have for sibling bickering from being cooped up? They get outside every day, they're exercising, but now there's little to no privacy in this environment. So what do you think?
Yeah, so conflict has been a hot topic of my sessions with patients over the past 2 weeks, especially. Like, I think that, the conflict is building in a lot of homes, and it's understandable. Conflict increases, whether it's between siblings or between spouses or between kids and teens and their parents during times of stress. And we are all weathering storms right now. And so it is understandable to see more conflict. There's certainly some things we can try to implement in our homes to help with this. And I think the first being, this is a really good time for us all to practice perspective taking, among our young children, but us as adults as well. I think that sometimes we get really stuck in our storm, and it's hard to think about the storms others are experiencing. And so I've actually assigned a number of my patients this week some perspective taking skills and practices, and we're working with what they like, with what they do. So I've actually have, a sibling group right now, a patient and their sib. They were going to watch Frozen 2, and they had some questions. Why is Anna feeling like this? How do you think Elsa feels when Anna says this? And so they're engaging in some perspective taking skills practice in a way that they were both could buy into and could enjoy, and give parents some time to build those skills. One thing though that I often warn about when the conflict occurs with your teens, I see this happen with patients a lot, is, sometimes we, in our attempts to be empathic and to really engage in perspective taking, we can over identify, and that can be really upsetting to some and make kids and adults feel really isolated. And so during these times of conflict, we want to promote our family members to engage in that perspective taking without kind of over identifying or dismissing those concerns. So what I will say with patients is, I don't know what it feels like to XYZ. I don't know what it feels like to have the prom that I was really looking forward to canceled. I don't know what it feels like to, spend all day with my 5-year-old brother who's been driving me crazy, but I do care what it feels about for you. And I think that those are lines that we can really teach our kids to practice saying, and really live by those words. So encouraging some of that perspective taking, pausing, asking your kids to say, hey, how do you think your brother feels when this happens, when they've spent all day building those Legos and we crash them? Or even when they're watching a show, Daniel Tiger or what else, encouraging them to do that. Another thing that could be helpful when conflict is high is having family meeting. It might be over pizza or ice cream, or sitting outside and providing a space for everyone to take a turn and kind of say, these are the things that are really hard for me, and these are the things that help me. And through that, you may come up with um, some new problem solving together. So another thing that I've implemented this week, last week with a patient's family, was, helping the others in their home know kind of what their current state is. And I know we've talked about this in past weeks, when we've talked about emotion regulation and kind of what zone they're in. So I had a family where each kid kind of picked their animal scale. So, one loves dinosaurs, so he's either a T-Rex or he's a, I don't know dinosaurs, but like less angry plant-eating dinosaur. And the other one is a unicorn or a turtle. And, they have these symbols and they have them on their door. And so brother or sister knows, I don't really want to go mess with them right now when they're a T-Rex. And hey, they're a unicorn. This might be a good time to go to see if they want to go play this game with me. And so from family meetings, we may help each other understand kind of what are our big stressors or our trigger points and how we can work through that together. And then the last thing I would say is that, and we keep talking about this, but also making sure that we're building in some positive time together as a family amidst all of these stressors, whether it's the walk or it's a special time for ice cream or a treat. Another thing that I recommended with a family last week is each kid made their own list of kind of favorite activities or preferred things to do. And so, brother has one list and sister has one list, and those are the things that they like to do. But they also worked on a shared list. So make a fort together and watch a movie. Play a video game that they both really like. Go for a nature walk. And so they made this list. And so then, the parents can say, hey, last time you did something from their list, why don't we go and pick something from the other one's list today? Or how about we pick something together? And so it was just kind of having these available to the family to use, problem solve their way through it. So those would be kind of some things to put in place. Other ideas people have?
Those are excellent strategies. And I think they both involve perspective taking, but also putting the kids a little bit in charge of how do you guys want to solve this next time, so that they have a little more buy-in. And I've been reminding my 6 and 10-year-olds that they can't read each other's minds. And so they have to communicate a plan. What is your plan? I think you just grabbed that, but you didn't tell him what you were going to do with it. So that's why he got mad at you. So if you can be the parent who debriefs a little bit and helps kind of translate for one child to the other, not, over micromanaging, but helping them understand if they can communicate a little bit more, it might reduce the amount of conflict they have.
I also just love that when you have, I love the idea of the animals as an indicator of sort of internal state. I think that's fabulous. And you could come up with all kinds of ways of doing that. And that's just teaching such important self-regulation strategies too, the emotional awareness of what I'm feeling and what I need. And one of the things that I've been thinking about is that, siblings and parents all need timeouts sometimes. We think of timeouts as sort of sometimes like a bad thing, but actually it's a really effective strategy to find a way to actually have some space and time. And so, for siblings to find their own special place where they can go and retreat when they need some downtime, and to sort of each have that place and honor it. I had a family where it was a small apartment. They didn't have a whole lot of space. And so actually the timeout spaces were closets in the 2 bedrooms that were in the house, and they put pillows in and they made it really cozy and really sweet. And the kids really loved to go into those retreat spaces. So, all of these things really teach important skills, both about negotiating with one another, but also sort of the, opportunity to self-regulate.
Right.
And yeah.
Recognize when you need a break. Yeah, we definitely, the first couple of weeks, had like a fort. My kids share a room, and they really needed those little secure little cubby spaces separated by blankets where they would read. And it probably also made them just feel a little safer and secure in a time that there was a lot of uncertainty going around. So I also have been encouraging parents to talk with kids about what their chill out zone or their timeout place or their little relaxation zone is going to be, so that they can recognize when they're getting riled up, or when you need to separate the kids and let them go chill out. Then they can have that space where they can read a book, or they can, listen to music or something else. So it is what I love about what we're talking about. And I bet on a future episode, we should come back to siblings, because I think you all have really great ideas. And this is something that lots of families are struggling with. But I like the idea of using this difficult moment as an opportunity for teaching or learning new skills, or practicing skills that are social and emotional, that our family may have felt like we mastered, years ago. But it's even more important to learn how to access those skills during times of adversity, as a source of resilience. And I've also been saying to a lot of patients this week something, I can't remember, it was Kate or Sheila said, taking that kind of passive helplessness and turning it more active, and not saying what's being done to me, but what can I do in this moment? And that reframing of a mental state, I think, has really been helpful to the families I've mentioned it to. So I just want to recognize this conversation has kind of been about taking that crazy of when your kids are just at each other's throats and trying to make more of a learning opportunity out of it.
No, I completely agree, Jenny. And I think one of the existential questions about this time, on the one hand, is I'm worried, I'm nervous, there's this germ out there, I don't want to catch it. And on the other side is I want something good to come out of this. I want to learn something, I want to help in some way. And so turning that space for families into one in which you can help, you can make a difference, you can learn some skills, you can write letters, you can do certain things with your sibling, really helps children feel like I have taken this moment in time and I've done something with it, and they'll remember that.
Well, I think that's a great place to end. And thank you, families, again for joining us. Thank you, Melissa, Sheila, and Kate, for all your wisdom. Please, parents, keep sending us questions or concerns. We're happy to keep answering them. And we hope you have a great week. Stay well.